Imagine a patient walks up to your front desk carrying a piece of paper, and you can kind of tell they're upset. They place the paper on the counter and they say, "My insurance company just sent me a bill for $119. You ask, "Are you sure that's a bill, or is it an explanation of benefits?" Patients confuse these documents all the time. But here's the thing. An explanation of benefits, or an EOB as we call it, is not a bill at all. It's a detailed explanation of exactly how the insurance company processed the claim. And an experienced front desk medical receptionist can usually tell exactly what happened by just glancing over the EOB. They look at, did the insurance pay? Was there a deductible? Was there coinsurance? Was the claim denied? Did the provider charge more than the insurance company allowed? The answers are all right there on the EOB. So today I'm going to show you how experienced receptionists read the EOB and why learning this skill can make you a much better front desk medical receptionist or a patient access representative or even a medical biller. So an EOB is simply a report explaining how the insurance company processed the claim. Think of it like a scorecard. It answers questions such as who received care, which provider submitted the claim, what services were billed, how much did the provider charge, how much did insurance allow, what portion might the patient owe. Every line of the EOB tells part of a story. An experienced receptionist don't simply look at the payment amount, they investigate the entire claim. So step 1, make sure you're looking at the right claim. Look for patient's name, member ID, claim number, date of service, provider name, insurance company. If any of these don't match the patient's visit, stop. You may be looking at the wrong claim. It sounds simple, but you'd be surprised how many billing problems start because someone reviewed the wrong EOB. Step 2, look at what the provider billed. Now move down to the section that shows the services. In our example, there are 2 services, an office visit and a laboratory panel. The office charged $275 for their office visit, and the lab charged $160. Together, the providers billed $435. Now, here's an important lesson. Just because the provider bills $435 doesn't mean the insurance is going to pay $435. This is one of the biggest misconceptions that patients have. Insurance companies just don't pay whatever the provider charges. Now look at the allowed amount column. This may be the single most important number on the entire EOB. For the office visit, the provider billed $275, but the insurance company only allows $175. For the laboratory panel, the provider billed $160. But they allowed $100. Together, the provider billed $435, but the insurance company recognized only $275 as the contracted amount. Why? Because this provider is in network, and we all know what in network is based upon our previous videos. When providers join an insurance network, they agree to accept negotiated payment rates. Those negotiated rates are called allowed amounts. Step 4, understand the network discount or the contractual adjustment. Now let's look at the plan discount column. This is sometimes, like I said, called the contractual adjustment or network discount. So for the office visit, the discount was $100. For the lab panel, the discount was $60. Together, The provider writes off $160. Notice what happened? The provider billed $435. Insurance only recognizes $275. So that $160 difference isn't transferred to the patient. It's a contractual adjustment because the provider agreed to that in those contractual terms. Patients often ask, insurance didn't pay that amount, so do I owe it? No, not if the provider is in network. This is one of the most misunderstood concepts in healthcare billing. Step 5, look at the deductible, copay, and coinsurance. Now we can see how the patient's responsibility was calculated. For the office visit, $50 was applied to the deductible. The office visit copay was $30, and coinsurance was $19. Insurance paid the remaining $76, but now look at the laboratory panel. There wasn't a deductible. There wasn't a copay. There was $20 in coinsurance. Insurance paid $80. When we total everything together, insurance paid $156, and the patient may owe $119. Notice something important? The patient doesn't owe the original $435. The patient only owes the portion of the allowed amount, not the total charge. So make sure the math tells the whole story. Experienced receptionists don't stop after looking at one number. They make sure every number tells a logical story. Let's follow the math. Provider billed $435 minus the network discount of $160 leaves the allowed amount of $275. Insurance paid $156, leaving $119 that the patient may owe, assuming they don't have a secondary. When the numbers don't make sense, that's when experienced receptionists begin investigating. Now let's look at another section that many beginners skip, the benefit accumulators. This tells you how much of the patient's deductible and out-of-pocket maximum has already been met. In our example, the patient's annual deductible is $1,500. They've already met $650. Their annual out-of-pocket maximum is $5,000. So far, they've paid $1,140 toward that maximum. So why should the front desk even care? Because these numbers explain why patient responsibility changes throughout the year. Early in the year, patients often owe much more because they haven't met their deductible. Later in the year, insurance may pay a much larger share. And eventually, once the patient reaches an out-of-pocket maximum, many covered services may be paid at 100% for the rest of the benefit year. Now let's talk about the section that scares new employees the most. The insurance payment says $0. Many beginners immediately think the insurance company denied the claim. Maybe, maybe not. A $0 payment simply tells you one thing. The claim wasn't paid. Now your investigation begins. Insurance companies don't typically refuse to pay claims. They explain why they don't pay them. Those explanations come in the form of the claim adjustment reason codes, often called CARCs, or you'll also see them called remark codes, or RARCs. Let's talk about some common denial codes that front desk receptionists may sometimes run into. The CO16. This is because there was missing information. Maybe the patient's date of birth was entered incorrectly, a diagnosis code was missing, documentation wasn't submitted. Many CO16 denials can be corrected and resubmitted. CO18, duplicate claim. Insurance believes they've already processed this claim. Don't automatically rebill this claim. Investigate it first. CO22, coordination of benefits. Another insurance company may need to process this claim first, and this often happens when patients forget to update their insurance information. CO50, service not considered medically necessary. Sometimes in this case, additional documentation or an appeal may be used to overturn this denial. CO97, the service is included in another service that was already paid. This usually involves billing edits or bundling rules. CO109, claim filed after the filing date, timely filing. Unfortunately, these denials often cannot be corrected. The PR1 is a patient's deductible. It's not really a denial because insurance processed the claim correctly. The patient simply hadn't met the deductible. PR2, patient's coinsurance. Again, not a denial, just the patient's portion of the allowed amount. So why does all this matter for people working at the front desk? You might be thinking, I'm not a medical biller, so why do I need to know all this stuff? Because many claim denials begin long before the billing department ever sees the claim. Many start right at check-in. Some of those examples include the wrong insurance was entered, the patient's coverage had terminated, the referral wasn't obtained, prior authorization was missing. Every one of those mistakes can eventually show up on the EOB. And understanding how to read an EOB helps you connect your work at the front desk with what happens after the claim is submitted. So instead of simply collecting an insurance card, you begin preventing denials before they happen. That makes you much more valuable to your office.